Right. Today we're getting into the nervous system, the neurons, specialized nerve cells, brain and spinal cord coverings, um, minglings, um, cerebral spinal fluid, CSF, communication, sensations, thoughts, emotions, and memories. Sensory neurons transmit nerve impulses to spinal cord of the brain or the brain from muscle tissue. Motor neurons transmit impulses to muscles from spinal cord to the brain. Alright. And it's just showing, just talking about, excuse me. It's just, it's just how the nervous system works. It's like, just like how the heart pumps blood to different parts of the body. Showing like how everything in the nervous system works. Right? Right? The central nervous system, CNS, it's the brain and spinal cord. Right? Peripheral nervous system, or PNS, everything outside of the brain and spinal cord. Right? You know what I'm saying? Just I'm pretty sure you're all familiar with your peripheral vision. Everything you see like outside, out the corner of your eye. Like anything you see, like direct line of sight is what's gonna be in front of you. Anything out of your direct line of sight that you see from the side, that's your peripheral. Right. Here we see uh, organization of the nervous system. To note that how the nerves of the arms extends close to the same areas where the venipuncture is formed. That's why it's very important that you be mindful when you're getting ready to form venipuncture to make sure that you're going for the vein and not a nerve. That hurts. The brain, along with the cranial nerves, function in all mental processes and many essential motor, sensory, and visceral responses. Spinal cord and spinal nerves control the sensory, touch, motor, um, voluntary movement, and reflexes like knee jerk functions. All that comes from your controlled sensories, which is controlled by the spinal cord and spinal nerves. All right, paralysis, impairments or loss of muscling strength, function, or sensation in one or more parts of the body. Can be uh, localized to one limb, generalized, partial, or complete, temporary, or permanent. Right. Psychology. As you all know, this is what I went to school for. It's the science of the study of the mind, mental state, and processes. Psychiatry, medical diagnosis and treatment of mental and or behavioral disorders. All right, so now we're going into the disorders associated with the nervous system. We have infectious conditions, which is infectiolitis, meningitis, poliomyelitis, um, herpes, tendinitis, post-polio syndrome, stroke, leading causes of paralysis, ALS, MS, Parkinson's disease, Bell Palsy, cerebral palsy, Bell's palsy, cerebral palsy. We also have epilepsy, hydrocephalus, neuralgia, headaches, spinal cord injuries, paralysis or partial paralysis, psychological disorders. Alright. And there you see the nervous system, um, and how See how everything is connected there. How everything runs from the spinal cord, the different vertebrae, the nerves coming from from your eyes, the heart. All of these things are connected. You see that there in your book. All right. You see here a child with cerebral palsy, an A. Um, and you see different causes, different forms of paralysis there in 1, 2, and 3 on section B. And this person is classified as being paralyzed from the neck down. Is paralyzed on the right side of his body. This person, number 3, is paralyzed from the abdomen down. I have a younger brother who is now involved in a fatal car accident where he went through the front windshield of the car, um, cracked his back in 2 places as he was being ejected. He's now paralyzed from the abdomen down. All right, chemical assays can reveal drug interactions as well as hormonal protein and enzymes alteration. Infections detected by bacterial, viral or fungal cultures or by the presence of specific antibodies or proteins. Therapeutic drug monitoring, um, we do that through mood stabilizers, just lithium, which is one antidepressants, etc. So whenever someone has a mental disorder, that will fall under the category of therapeutic drug monitoring because they're being prescribed these drugs to monitor and maintain um, their condition. Respiration all allows for the exchange of gases between blood and air. When gases, which is oxygen, which is O2, and carbon dioxide, which is CO2, enter the blood, the circulatory system transports them between the lungs and tissue. And think about that's what we talked about in EKG. Um, Together, respiratory and circulatory systems carry O2 to the cells and remove the CO2 from the tissues. That's why it's encouraged that you get X amount of you spend so much time like outside during the day because like our bodies work just like just like plants. Plants use the sun to produce energy and food through the process known as photosynthesis. The same thing applies for us. We need fresh oxygen to push out all the CO2 out of our bodies to keep that fresh oxygen is going to keep the cells in our bodies healthy. The healthier the cells are, the better they work, the less you have to worry about when it comes to like getting sick and things of those nature. Because once you start introducing all these harmful things into your body will start to get it will slowly begin to get sluggish like over time, leading to and your body won't be able to break down things the way it should. um, Some like 95 to like 97% of all sicknesses, viruses, medical conditions stem from the buildup of mucus in the body. Again, because these cells lack the proper oxygen and are not being able to work out, and then they're not getting their proper nutrition. They're not strong enough to keep the buildup of mucus down. Right? So that's why it's important that you get your sunlight. Make sure you guys take your vitamins and things of that nature. Again, like now dealing with the COVID thing. Again, say this is a virus that attacks your immune system, and their only response to this virus attacking your immune system is stay 6 feet apart, wash and sanitize your hands, and wear a mask. Really should be encouraging people to build up their immune system. If your immune system is strong, nothing can attack it. Right? So what your respiratory system looks like, you see your lungs, the red blood cells flowing through, separating you see the CO2 going in, the CO2 going out as the fresh O2 comes in. Um, right. Components of the respiratory system, you have your nose, is the primary filter for air entering the body. Um, you have your pharynx, which is tube-like passages for food and air. You have your trachea, your larynx, and your bronchi, passages for outside air to reach lungs. Larynx has vocal cords. Right, vocal cords are attached to your is where you can find your larynx is where you can find your vocal cords. Um, And the brachia, you guys can see, like if you go back and look on that, go back and look at figure 6-22. Those things that look like trees, um, those are called um, your brachia, your bronchi. All right, the lungs, you have two lungs. Right lung has three lobes, and your left lung has only two. Allow space for the heart. All right. Um, Your RBCs transport oxygen and CO2 via hemoglobin. And we'll talk about that later on. All right. Disorders of the respiratory system. You have infections. You have tuberculosis, multi-drug resistance, laryngitis, bronchitis, colds, sore throat, whooping cough, tonsillitis. All right. Some other infections: rhinitis, coughs, pneumonia, Lou Gehrig's disease, uh, pleurisy, respiratory distress syndrome, respiratory um, syncytial virus, influenza, and conditions such as asthma, emphysema, and cystic fibrosis, tumors, pneumocystis pneumocystis infections are considered opportunistic infections. All right. You see what the normal lungs will look like, and what they look like when they infected with emphysema, and what your regular bronchial tubes will look like, and what they will look like with if you have asthma. I just stated um, how majority of diseases and viruses and things of that nature stem from the buildup of mucus in your body. You see right there um, what your bronchial tubes look like with the when they have asthma. You see the constriction, and you can see the mucus built up in there. Right, blood gases, blood pH, chemical constituents, sodium chloride, bicarbonate, and potassium. Lung biopsies, throat swab, septum cultures, and bronchial washings can be examined microscopically or cultured for pathogenic microorganisms. Right? And it's just talking about how you can um, check for those things. All right, so now we're getting into the digestive system, which breaks down food chemically and physically into nutrients. Peristalsis, wave-like contraction of food through the intestines, eliminates waste, produces waste products of digestion. Gastrointestinal tract is made up of your mouth, teeth, pharynx, esophagus, stomach, intestines, both small and large, vital sensory organs, saliva glands, liver, gallbladder, pancreas, and your appendix. Alright. I'm saying that all those things are, as stated, vital to the digestive process. See your digestive and gastrointestinal system here. All right, so dental caries and periodontal diseases, um, stomach disorders, right? Gastroesophageal, it's reflux disease. Um, right, then you have hiatal hernias. In the event that someone suffers a hiatal hernia, they would need to see a thoracic surgeon um, to get a procedure done. Um, and there's a protrusion through the diaphragm. Um, Irritable bowel syndrome, IBS, vomiting, H. pylori, peptic ulcer disease, peptic ulcer disease. Alright. Intestinal disorders, you have your polyps, mild digestion, malabsorption, cancer, appendicitis. Alright. Intestinal disorders, constipation, diarrhea, dysentery, hemorrhoids, pancreatitis, um, liver inflammation or hepatitis, excessive alcohol consumption, viral hepatitis, gallstones. Um, More than certain that a lot of people are going to be diagnosed with hepatitis after the the pandemic is over, um, because people are consuming a great deal of alcohol during this time. Like everyone is day drinking. Every time you look around, anywhere you look, people are just living their best quarantine life, day drinking. Right? Bacterial or parasitic infections, staphylococci, food poisoning, salmonellosis or salmonella, H. pylori, thyroid fever, cholera. This can be contracted through drinking contaminated water. And then you have geodiasis. You have tapeworms, pinworms, hookworms, roundworms, or medically known as asteriasis. Tissues by tests done on the digestive system, tissue biopsies, alkaline blood tests, which is testing for blood in the feces, bacterial cultures, analysis of oval and parasites, gastric analysis of blood specimens. All right, the urinary system. You have is made up of two kidneys, two uh, uterus, a bladder, and urethra. Mm. The urinary system produces and eliminates urine. It regulates the amount of water and electrolytes. The electrolytes being regulated are sodium, potassium, chloride, calcium, phosphate, and magnesium. Okay. Again, flipping back to EKG, we know that during the contraction process of the heart, the beating contraction process of the heart, we know we got sodium coming in and potassium going out, and vice versa. Um, some things that I noticed like early on, like in during my time in the field, that it was very seldom that when people would come in with heart conditions, um, that they would be asked about their bathroom routines, like far as urination goes. They're not asking about how much water that person has been consuming, right? Because water is the secret stuff. That is what makes the body go. Um, a great deal of the body is composed of water, so you need water to function, right? Uh, Water, in addition to the fresh to oxygen coming in, and it's just going to make your cells stronger. They're going to produce the cells are strong. They're going to produce healthier cells, and those cells are they're going as they operate in the different organelles and tissues and things of that nature. They're going to perform at their at the best they can, and everything is going to run the way it's supposed to. Um, as the potassium and sodium is being pumped throughout the body, after the it absorbs what it needs, all the excess will be eliminated through the urinary tract. All right. Again, I brought all that up just to say that again, we want to make sure that you know how these things work, because the more that you know, the more in tune you are with the situation of what's going on, the more information you have about the patient's diagnosis or what could lead to the complication that this patient is having. Because again, keep in mind that they do consider you to be the expert, is going to help you make better a better diagnosis to ensure they get the best treatment possible. All right. Again, you want to make sure that you know all of this stuff is not something that we just fumbling through out the textbook. All this stuff is very important. Everything goes hand in hand. All right. All right. In addition to to regulation, it also excretes nitrogen uh, and waste products um, from protein metabolism again, as things go throughout the body, and they break being broken down, the body takes what it needs. Everything else will be will have to exit, have to vacate premises. All right. Normal ratio of cardiac acid to base biocarbonate is 1 to 20. Blood pH and blood gas determination provides information about the acid-base balance in the body. Normal blood pH is 7.35 to 7.45. All right, and this is what your urinary system looks like. See everything that it's made up of. See kidneys and things of that nature. All right, here you have your retinal, um, tubular, Some disorders of the urinary system: acidosis. Blood pH is less than 7.35. Alkalosis, blood pH is more than 7.45. All right. Nephritic syndrome, cancers, diabetes, retinal vein thrombosis, pericarditis, malaria, syphilis, bee sting, transplant rejection, etc. So these are things that'll come up where everyone is out getting having work done, getting the butt lifts, the breast implants, the penis implants. While even if you go to the best surgeon in the world, that is only going to be able to hold up in your body for so long. And that's just and I want to just limit it to that. Hip replacements, all these things, they're only going to hold up in your body for so long, before your body eventually starts to break these things down and starts rejecting them. Metal hip plates, all the acid in your body. If you're not drinking enough, if you have a horrible diet with a like metal hip replacement or whatever, and your blood becomes too acidic, then the acid in your blood, as it rushes over, that hip replacement is going to start to corrode that over time. All right. And the same thing with the other transplants. Okay? If it's not supposed to be in your body, it shouldn't be there. Um, and after so long, your body is going to kick it out. It's going to tell it's got to vacate premises. Acute or chronic disease, glomerulonephritis. It's the end stage of retinal disease. All right. Lab tests done for for the urinary system. You have the urinary dipstick test, evaluation of blood specimens. All right. Oseo osmolality. As you know, to break this down, what this is, think about the term osmosis. Osmosis means um, is the process of water passing through a barrier. So this is where we're dealing with the amount of water that you're consuming. Again, is your body able to filter the water and get it to where it needs to be? Uh, Again, you keep that strong by drinking water. All right, glomeruli, glomerular filtration rate, and chemical constituents. All right. Chemical analysis: albumin, ammonia, creatinine, total protein, blood urine, nitrogen, uric acid, blood pH, blood gases, electrolytes in the blood. Creatinine clearance evaluates degree to which kidneys are filtering out waste. All right. Uh, Here you see your endocrine glands and their hormones: pancreas, thalamus, thyroid gland, kidneys, all of that. Endocrine glands secrete fluid, sweat, saliva, mucus, and digestive juices. All right. Their ductless glands. Hormones go directly into the bloodstream. The hypothalamus, pituitary, thyroid, and parathyroid. The thymus, adrenal glands, ovaries, and testes. Many inherited hormonal disorders, Addison's disease, Graves' disease, Hashimoto thyroiditis, Cushing syndrome, dwarfism, acromegaly, giantism. So then we have diabetes insipidus, mellitus, subacute thyroiditis, trophoblastic tumors, hypo and hypothyroidism, neonatal hypothyroidism, hyperinsulinism, hyperglycemia, goiter. Chemical assays for all types of constituents regulated by the endocrine system: glucose, insulin, renin, serotonin, erythropoietin, cortisol, etc. Specific thyroid function tests. And all these are tests that can be done on the endocrine system to determine what's going on, where the attention needs to be focused. Right. Moving along to the reproductive system. For the males, you have your testes, your seminal vessels, your prostate gland, the epididymis, ejaculatory ducts, urethra, penis, super spermatic cords. The primary function is spermagenitis, which is sperm production, storage, maintenance, and excretion of seminal fluid, secretion of hormones. Um, the dominant male hormone is testosterone. All right. Um, and just like um, just like how the female reproductive system, whenever there's an egg release, it has to be fertilized in a certain amount of time before the before it's discharged through. Um, Exposed through menstruation. The same thing applies for semen and sperm. Um, it does have a longer shelf life. Um, it takes a it takes a while for it to die. Um, like sperm is being produced like every 3 days. Um, so you want to get the old semen out of there. Um, because again, as that semen lingers in the body, and it has nothing to do, um, it ages really, really fast. And in the event that um, procreation is trying to be made during a time where the sperm has been sitting there too long, that will also lead to um, genetic disorders. All right, all right. With females, you have your ovaries, your fallopian tubes, your uterus, your vagina, your labia, your breasts, and your mammary glands. All right, primary function, um, ovulation, fertilization, menstruation, pregnancy, labor, lactation, secretion of hormones, estrogen, and uh, and progesterone. Right, those are the two female hormones. Um, Estrogen being the main one. It's very rare that you hear about progesterone, but it is just as important. Okay? Biological identity and gender identity. Intersex individuals born with internal and external reproductive systems, not considered standard for either male or female. Gender identity, gender a person feels or perceives based on their own personal experience. Right? That's why uh, it's such a the LGBT um, Q community is making such a big push. That's why you shouldn't. Everyone is insisting that you try not to um, force anything on a child based off you. These things must be determined through their own personal experience. That's how people gain their gender identity as a whole. You don't know what type of person you're going to be until you endure things in life. Right? These things can make you or break you. Depends on how you handle the situations. Um, want to make sure that you learn from, seek out every learning experience in every situation. There's a learning experience in every situation, whether it be good or bad. So make sure that you seek that out in every situation. Um, for this, with the distant learning, you all came to school because you needed that one-on-one attention and things of that nature. You needed a smaller classroom environment. But throughout this process, whether you are learning, you realize it or not, if done properly, you are learning and exercising a great deal of self-control and discipline, because you have to make sure that you log in every day. Um, there are certain rules that you have to follow, like i.e., like if something goes wrong on the system, you need to report that to um, myself, or just like you would in the workplace, you would have to report that to your superior. Okay, now if you just decide to like blow things off because you have something going on, um, it's only going to hurt you in the long run. So again, uh, just I don't want you guys to just think that, hey, this online thing is like the worst thing ever. I want you to look at the learning. Um, what is it that you're learning from this? Again, um, some of the main things that jump out to me is the discipline and self control. Okay, and those are things that will ultimately help you be successful at work. All right. So what the reproductive system looks like for both males and females. All right. Disorders associated with the reproductive system. Malignant tumors, cysts, sexually transmitted diseases, gonorrhea, genital herpes, syphilis, um, human immunodeficiency virus is the HIV virus. And back to we talked about in previous chapters, HIV, if untreated, will turn into AIDS. They are two separate things. Infertility and gender dysphoria, and that's where you have your things like your transgenders, and things of that nature. All right. Tests that can be done on the reproductive system: fertility tests, semen analysis, anti-semen antibodies, hormone analysis, cytogenetic analysis, cross-sex, hormonotropic, gender-affirming surgery options. So again, like as people grow and come into their own way based off their own experiences, they feel as though they identify with one gender versus the other, and that's what they're comfortable with it. Then that's where you can have that's where your gender surgeries come into play. Blood testing, tissue biopsies, pap smears, microbiological and viral cultures of infected areas, viral cultures of infected areas. Laboratory test panels, basic metabolic panel, comprehensive metabolic panel, cardiovascular screens, electrolyte. Have your hepatic function panel, your hepatitis panel for acute, um, retinal panel. Have new polymerase chain reaction methodologies, genomic testing expanding, clinical laboratory personnel knowledgeable about acquiring and handling processing specimens for transgender patients. And again, as time goes on, the LGBTQ community people um, continues to grow, and they become more accepted by society, we'll be looking for more people that specialize in these areas. All right, knowing how to handle and transport um, the specimen. All right, so you guys make sure that you hone in on the specimen transportation process when we touch on that, um, because the process is going to be the same across the board. All specimens need to be transported in about the same manner. So um, the better you are at it, the better understanding that you have, more job opportunities that you'll have in the future. All right, emerging terminology. Healthcare workers should stay abreast of emerging technologies and health issues, micro, microbial resistance, infections such as Zika virus, etc. This kind of further expounds on what I just talked about on that last slide. For the more that you know as things continue to grow, the better you'll be for years. It's great for you to know again, so it'll help you make the proper diagnosis. Again, I want to keep harping on it because the more you know, the better that you will be. When it comes to getting a job, I spoke about this before, and you're going to hear me say this quite often, especially on the career service end. It's about the value that you bring to the company. The company has already invested anywhere between 130 to 150% of the salary they're going to pay you for that entire year to bring you in, train you, get you insurance, get you uniforms, all of that. So they're looking for a return on their investment. So the more that you bring to the table, is going to help you stand out. That's going to make you stand out in the interview, and it's going to help you excel faster on the job. A lot of people, become complacent because, oh well, I have this going on, or thinking that the requirements for some, or thinking the requirements are too high, or thinking they lack the skills required to be promoted to another position or go on to do something else. But you won't know until you try. All right. So again, the more information that you have, make sure you seize every opportunity that you have to learn. Do your continuing educations for your certifications, to keep your certifications current. Again, now, and don't just harp on like the assignments that I post on here. You guys should be reading the books, um, looking up videos similar to videos that I post, making sure that you keep these things fresh on your mind. Repetition is the father of learning. So the more you see something, the more you do something, it's being embedded in your mind. You'll be able to recall these things on the spot because you spent so much time um, printing it in your mind. Um, so don't think, again, throughout this process, don't think that you're not learning anything. Um, it's all going to come back to you in the blink of an eye when it comes time for you to step up to the plate and do certain things. You may need a couple practice runs. I'm not some of you may, and then some of you might not. But again, it's all of this is a learning process. So make sure that you are obtaining as much knowledge as you possibly can. Knowledge is power, right? So again, make sure you read, do the assignments, make sure you have a thorough understanding of the assignments. Um, do your CEUs, research things on your own. Uh, saying that I mentioned earlier in one of the earlier slides about how they changed this textbook over the years. Um, our first couple times with this, we didn't have there wasn't any mentioning of the LGBT community in the books or the Ebola virus. All right, so since in the last 8 years, 12 now, in the last 12 years now, we've dealt with um, many viruses. And you could actually even go back before that. The West Nile virus, Zika virus, Ebola virus. Now you have the coronavirus. These are things that you're going to see come up in textbooks later on. You guys may not be in school if you choose to go to school, but you will see these things come up. Um, Again, there could be another outbreak or something with things, and you'll know what to look for and how to uh, properly diagnose a patient based off the knowledge that you have attained. And it's just applying what you know, and a lot of stuff is common sense. Again, I'll go back to the example that I gave earlier, talking about the coronavirus. This is a virus that attacks your immune system. The only treatment that they are offering right now is wash your hands, stay 6 feet apart from people, wear a mask. If this disease virus attacks your immune system, why aren't people being encouraged to build up their immune system? Right? That's it.